So we are doing part two with Onkar. He's a dentist in Essex in London. He studied at King's College London, and he's going to really be telling us how to make the most of dental school. He won the Portsmouth Award, so if you don't know what the Portsmouth Prize is, he's going to let us know exactly what it is and how you might win it yourself. Thank you, Onkar, for being with us in this series, just sharing a dental journey. Thank you for being with us today.
Again, thank you for having me. Like I said to you before, it feels like therapy on a Saturday morning. It's very nice to just talk. It's nice to talk through the story. But yeah, no, Kings. I mean, what would you like to know about Kings? Where should we start?
So I want to know your first week, your first few weeks. How was that experience getting into clinic for the first time? What was it like? Was it overwhelming? You've been trying so hard to get into dental school. Now you're in dental school, is it now smooth sailing?
Do you know what? I'll be completely honest with you. That first year entirely felt surreal. When you've wanted something for so long and then you get to that point.
Yeah.
And King's was always the dream uni. I was torn between King's and Leeds for a long time. They were my top two. And, luckily enough, I had my gap year. I had the offers from King's and Leeds. And I was like, this is perfect scenario. I got into King's, and yeah, that first year was amazing. The first week, looking back on the first week, Freshers Week, it was good. It was really good. It was quite intense because a lot of people were straight out of sixth form. So they were like, obviously 1 year is nothing in the grand scheme of things. But there were a lot of people straight out of sixth form, very clever, 3A stars, got in the first time round. And then again, you get that little feeling in your head, am I good enough to be here? I'm a gap year, I've resat the year. But
is that a big thing in terms of your A-level grades? Do people have that competition?
Yeah, so
at the start, kind of size each other up.
On the first week of uni, it was all, where did you go for sixth form? What did you get? What interviews did you get? How many offers? Like, I remember that so clearly. And I remember being like, everyone was like, I got an A star, A star, A star. And I was like, I got 3 A's. But like, that's the offer. I got 3 A's. I got in. Like, we're on a level playing field, They don't know. I didn't really feel like I needed to tell them my struggle just at that point. You don't need to tell everyone the struggle. So I was just, to them, I was just a gap year that had 3 A's and I got in. So yeah, that first week was intense. Everyone's trying to find their feet. No one's really friends yet. You kind of feel a bit alone because you're at a new place, but then you also have all these new people to talk to. So yeah, it was a bit overwhelming. King's has 130 in a year. It's the largest year group in any UK undergrad dental school. Yeah. So initially I did feel quite overwhelmed because going from a gap year, having a circle of 6 friends, you've now gone on to a year group of 130. Thankfully, my gap year friends for dentistry all got into dentistry too. So that was nice that we all got in together. 2 of those, in fact, ended up at King's with me in that same year. So we had each other, that was a good support network. Also had a lot of my post-grad friends that I knew that were like 2 years older than me that had done like biomed or biochem or a different 3-year degree, actually started at King. So I had a few people when I started, so I felt it was quite nice.
Yeah.
So first week was good. Freshers Week, obviously, a lot of going out, a lot of socializing, which I would recommend if you're a social person.
Yeah.
I know some people don't like big crowds, and we all have our own things that we don't like. But if you can get into Freshers Week and just try and socialize with people and make friends and do that, I would definitely recommend, because it makes the first week at least a bit more easy for you, because it is quite intense. It's quite an adjustment period.
Yeah.
I did that.
How was the first few lectures, and then your first experience of the phantom head and getting to actually hold a handpiece? What was that like?
So King's is all lecture based in first year.
Okay.
You nurse for the 5th years when you're in first year. So the first few lectures, Arnold, were intense. They were all on. We share the same syllabus with the medics in our first year. So it's like general learning basically. So it was all physiology and biomed and biochem, and I was like, I thought I left this stupid chemistry behind and it's coming back to haunt me. So I had to get the OCR textbooks again. I actually bought them to uni with me because I knew I'm going to be haunted by this chemistry. So the first few lectures were quite intense. When we got into physiology, I absolutely loved it. I was like, this is the dream. This is what I want to do. Still quite challenging, but we'll touch upon why I found it challenging. I'll tell you everything about that.
Yeah.
My first experience on clinic was setting up a dental chair for the 5th years. So they, like, the nurses take us in, they give you your tunics, you know, everyone takes that picture in a tunic for Instagram, like dental school, we made it. And then had our first induction, and you know, that was pretty intense. Taught us how to set up the dental chairs, and we all stressed so much and wrote like everything step by step. Wipe down chair for 20 seconds, rinse lines for 30 seconds, and like we then got tested on it in an OSCE. So that was pretty intense. The funniest thing was, they go to us in our first year, why don't you guys have a feel of how it feels being in the operator chair? So literally, this was 3 weeks into uni.
Yeah.
They made us and a partner up, and then someone gets in the chair, someone gets whatever in the operator seat, and then they were like, why don't you guys spray water in each other's mouth and use the suction just to get a feel for it, how it is to nurse? I couldn't suction. I kept getting the cheek and the tongue, and I got someone's nose. I was like, what am I doing? Like, all this manual dexterity I had now gone. So I remember just laughing to myself and calling my dad and being like, I can't suction. And he was like, don't worry, come with time. So yeah, that was funny. And then we did all of that. We had a bit of an OSCE, clinical OSCE. So had an exam on like charting, so like charting teeth and setting up a dental chair and all these things.
Yeah.
That was in January of my first year. So we passed that. And then
so
we were allowed.
Before we move on, a lot of people can sometimes worry and get concerned before dental school and think they've got to start doing some reading and studying before they start dental school. What would you say to that?
I'd say no. I'd say, like, you know, there's a lot of things you can read online. You can find brilliant articles on like the BDJ website, BDA, wherever you look, Dental Update. But there's no need. A lot of it will just be gibberish to you because you won't understand what you're reading.
Yeah.
With the advent of Instagram and social media, like when I started uni in 2014, there weren't many Instagram dentists.
Yeah.
I think there was just bloody tooth guy doing extractions, and that was about it. You know, I didn't even have Uber in my first year of uni. That's how old I feel. Like there was no Uber. There was only Addison Lee. So going back to that point, I'm glad I didn't read anything because it probably would have stressed me out. They teach you a lot in your first year, like what you need to know. So I wouldn't do any reading, but with the advent of social media and all of the Instagram dentistry going on, I think a lot of the young generation are a lot more clued up now.
Yeah.
They already know what rubber dam is, they know what composites are, they know what, like, and I know it sounds really simple, but I didn't know a lot of that. Like, obviously I'd done work experience, but I didn't know when to use composite bonding over a crown, for example. But a lot of these new first years coming in, they have a really good baseline from Instagram.
Yeah.
So
it's crazy because obviously it's not the same as work experience, watching and observing a dentist, but it's better than what was there before.
Oh, 100%. Like, you know, when you've got time lapses of composite bonding or time lapses of an endo or something, like, it's knowledge that you pick up. And I didn't have that. I watched things in real life. I took a notebook and I made notes and I went home and Googled them. That's how I did it. So when I was doing work experience, and I still do that. So no, I would say don't read anything. Go in with an open mind. If you have questions, ask the nurses. They're full of information, and just go from there.
Yeah. Okay. So first year went well, went okay. Were you getting involved in anything else during second year, third year, up to final year? Were you doing any things?
So I did quite a lot. First year was quite intense. I found it quite challenging academically. I passed everything, but it was a slog. Like, I was in the library a lot. I'm quite a social person. So alongside doing extracurricular things such as the Dental Society, naturally, and I did a bit of RAG, so KCL RAG, like raising and giving. I like charity, I always have done, and for me, I always wanted to do RAG, so that was like, you know, with the buckets, going around London, going around doing fundraisers for cancer research, AIDS, orphan, all the charities that we know, Oxfam. I did a lot of that in my first year. And that let me meet a lot of medics, because it's quite a medic thing. Not a lot of dentists do that. So I did that. That was really fun. did a lot of socializing as well, like just generally joined a lot of different societies.
Yeah.
Looking back, I would have probably joined a sports team like in my first year. I didn't do that because I was just a bit shy, a bit nervous, but I would have probably joined a sports team going backwards all those years ago.
What sport would you have done?
Probably hockey or cricket. I regret not joining them because I played cricket all of school, but
Yeah.
I just didn't join it because I thought, like, again, you have these thoughts, they're going to be so good, they're in a uni team, but really it's just for like, they're good, but it's for the social as well.
Yeah.
So I should have done that. That's my only regret, is not joining a sports team, but the rest of it was amazing. I found first year quite intense, and something that I've not told a lot of people, but because we're being transparent here, is in my first year, I had a meeting to, shock horror, transfer to medicine.
Oh, really?
Yeah. I found first year quite hard, and I was learning a lot of biomed and physiology and anatomy, which I loved. And I wasn't enjoying oral biology. Like, I just wasn't enjoying it. I wasn't enjoying teeth. I wasn't getting it. I wasn't like, I just didn't feel like I was there. People who were really passionate about teeth on the course,
Yeah.
and I felt I wasn't. So I had a meeting with them about switching to med, and I've not really told anyone this, but I guess it's nice to be completely truthful. And they said, if you want to do it, you can, but you've got to pass your first year, then reapply. So take another year out, redo UK CAT, do a new personal statement, reapply.
Yeah.
This is not for me. I can't do that all over again. So I went through first year, did well in the exams, smashed it. Second year came along, started Phantom Heads, and that's when I fell in love with the degree. That is literally when I fell in love, was that practical element.
Yeah.
I can't stress that enough.
I completely agree, because for me the theory was, it was okay, but it was when I started talking to patients, getting practical, hands-on, that's when I was like, yeah, I'm in the right career. So similar for yourself?
Similar for myself. Like, a lot of my friendship group at that time, we had doubts on whether dentistry was for us. Like, we were like, medicine, dentistry, we were all enjoying the medicine side of it so much, but not so much the oral biology and the dental materials lectures. I was like, is this dentistry? Again, a bit of naivety on my part. So I had that meeting, but I'm so glad I just stuck through, because that second year of doing practical dentistry and seeing my patients is what made me fall in love with it. And I never looked back after that.
And I think it's a really good point, because for anybody that's thinking that dentistry is not for them and they're still in the early years, maybe wait until you've experienced more hands-on and started seeing patients before you decide to say no to dentistry.
I agree completely. Like, that is the same advice I would give anyone, 100%.
So did you take part in any competitions, any conferences? Yeah.
So during my time when I was at university, I mainly got more involved in the dental side of things, like when I was in my third year. Second year, again, I was quite focused on extracurricular, and I'd really fallen in love with the practical element of dentistry in second year. So that's when I started reading up more on things like composite bonding, crown preps, crown materials, things like that I could have access to. And that's when I started following a few Instagram dentists, ones that are still posting, and still very active today. People like, Dr. Rona, people that were cosmetically driven. I started following them because I knew I enjoyed white fillings and composite work. And moving forward from third year, so I was involved in the dental society in my third year. So that's when I became the year rep in my third year. And then that kind of opened a lot more doors in regards to—
What does the year rep do?
Just liaise with the whole year. So was just able to provide them with up-to-date news, what was going on, any sort of timetabling changes, any issues that my year wanted relayed, I would relay them back to the appropriate people. If we had events such as any dental events like boat parties or any bar crawls or that, you sell the tickets and you collect payment. So it was just there was two of us. It was me and one of my other friends from my year. We were the year reps, and it was really fun to just get involved, because then through that I was able to attend the BDA, it was a BDA dinner, and that was a really good networking event. So I was able to attend that. And then obviously you have
British Dental Association.
The British Dental Association dinner that they do in London. That was really good. Then I was able to attend the like the BDSA, so the British Dental Student Association. Was able to go to the BDSA conferences, and that's where you meet like a load of dental students from around the country. That was a brilliant time as well. And then the lectures that are given on the days are often given by really, really good speakers. So there was one we had in Cardiff, and there was speakers. The speakers there were brilliant, like Dr. Rodri Thomas, Welsh, Cardiff-based cosmetic dentist as well. He gave us some lectures on that conference. So it's like, you know, you got to put yourself out there and do these things. And although you might feel as if like I'm a student, I'm a bit junior to be going to these conferences, there's nothing wrong with it at all. Go for it. I, in fact, regret not doing more research at uni. You know, now I regret not doing more audits or doing more posters, because that's the time when you're so supported with senior advice that it's the best time to do it.
So I'm a student starting out, and you're talking about conferences, you're talking about societies, you know. I'm going to learn dentistry from my tutors and my lectures. Why do I need to be going to these things and meeting these people? Why?
I think dentistry is like so much of it is your networking and how you meet people, and also what you can learn from people. You know, if I met you, for example, when I was a second year and we got on really well, it then opens the door. And I would think we would have gotten well if I met you in second year. I probably would have had less of a good beard, but we would have met. And, you know, then you can start talking, and then you can ask the questions like, can I come shadow you? Can I come watch you? And I found, like, during my time as a dental student, people were so supportive. Like, every dentist I spoke to was so supportive. And a lot of that came from meeting them at a conference or reaching out over social media, whether that's Instagram or an email. Like, I did my elective in fourth year, and I'm sure we'll touch base on my elective in fourth year, because it was a really good time for me in regards to showing me what I wanted to do. But yeah, that elective as well, a lot of that came from being able to reach out to people. But no, going back to your point, if you're a student, I'd say not only can you develop your knowledge by going to these lectures and know a lot more and come across as a really driven student, because it's like, yeah, you can be a driven dentist, but if you're a second year or a third year attending these conferences, you know, networking with people that are at the top of their game, it only shows drive, and it only shows that you're taking control of what you want to do. And I think that's brilliant.
Yeah, no, I totally agree. Dentistry's, it's a small community. And if you're able to start networking as a dental student, you're setting yourself up so well for when you're working as a dentist. So I totally agree. Let's talk about your elective.
Yeah, my elective was brilliant. So I would say I fell in love with dentistry in second year. Sounds cheesy, but that phantom head was brilliant. I then went to third year, started practicals again. I felt a bit overwhelmed because, you know, now you're on real people, you know, like we had second year on phantom head, and then we started perio, so like gum scaling for dentists for people that aren't dentists that are watching, like gum scaling, scale and polish, small fillings. We started that in second year, and that was pretty manageable. And then we had our summer holidays for 5 weeks, and then in third year we started, and I felt a bit overwhelmed, you know, doing like composites and amalgams on real people, because the tongue is crazy. You don't realize when you've done phantom head for a whole year that the tongue is
wild.
Your enemy. So I felt a bit overwhelmed in my third year. Like I felt a bit, I'm not good at practical, but it comes with time. And then fourth year came along, and I just found my feet, you know, like you start doing root canals, you start doing big composites, you start doing crown preps, and you feel like a bit more confident in yourself. So by the end of fourth year, I had done quite a lot of practical work, and I had read a lot around the subject, and I'd passed all my exams thus far. So I had a good baseline knowledge, and I was like, let me arrange my elective, because I haven't arranged it. I'm a bit of a last minute guy. Although I'm very like routine based, I'm quite last minute, but I get the job done. So elective was July and August of 2018. And me being me, I literally arranged it in July of 2018. It was very silly, but it worked out really well. So with my elective, I spent 1 week in London, within Harley Street, private dentists, and then also NHS dentists, because I wanted to contrast the two. I hadn't done any.
Just briefly explain what an elective is and what's the purpose of an elective.
an elective is encouraged by all unis generally. It's where you go and do some work experience and some shadowing. That can be in the UK or abroad. If you're lucky enough, you can also do some dentistry abroad as a dental student. You know, a lot of my friends went to South America and did some extractions in South America, you know, as they were supervised by the hospital. So yeah, it's just literally work experience, but as a dental student with the chance of you being able to maybe do some treatment.
Okay, so you were getting quite a good experience, Harley Street. Yeah, just carry on from there.
So Harley Street. So basically, I didn't know. I still don't know where I want to be in 5 years' time. But I know part of that end goal is to have some sort of cosmetic or artsy sort of dentistry. So I like that creativity. I've always enjoyed orthodontics. Even at uni, I've always enjoyed that. And I think the whole align, bleach, and bond protocol, although a lot of people do it, they do it so well, and the results are so good that it's just nice to see. So I knew in fourth year that was one of my interests, was like that. So I was like, let me go and see some people that do a lot of align, bleach, and bond. So I reached out to a few people that I really looked up to on Instagram. So that was Dr. Harmeet, so Harmeet Gurewal, who does like a lot of Rubber Dam, and he brought Rubber Dam into Instagram, you know. He's one of the OGs of Rubber Dam, I feel like. So I reached out to him. I reached out to Dr. Shivana Anand, who's now a good friend of mine, works with dental training consultants, doing her prosthodontics training, and at the time was doing a lot of cosmetics and a lot of facial aesthetics, so like lip fillers, Botox, and at that time I also enjoyed that side of things. Also reached out to Simon Shard, Dr. Simon Shard as well, and again, he was doing a lot of Surrec and a lot of CAD-CAM work, and I loved that, so that was really nice. Reached out to Dr. Peter McCullen, again at Harley Street Dental Studio, doing a lot of short-term ortho, a lot of composite bonding. Dr. Payman, so Payman Smiles, again in Harley Street. Again, ortho, composites, Rubber Dam. I reached out to loads of people, and I had a lot of rejections, but they were my main 5, and they all said yes. So every day was different with them, and I was just able to see how they work, you know. I was able to see what they do and how they talk to their patients and how they approach the private side of dentistry that we don't get to see as a student, you know. And it was really eye-opening. Like I loved it. I loved my elective. I had so much fun in London. It was a brilliant few days shadowing from some of the best in the game. And you know, they've all been so supportive. Like I'm still in touch with them, you know, like I think that is the point of an elective and dentistry and networking. You make those bonds and you form that relationship with someone, and you know, at the end of the day, like they're more than happy to stay in touch with you. And you know, with Shivana and Harmeet, you know, especially like I've stayed in touch, and Payman, all of them like have been really supportive. Like just dropping them a message when I was a 5th year, like this is my end of year case. What do you think? And just to get that advice from people that are so established was brilliant. And then I ended my week completely contrasting in an NHS practice in London, just to see what would really await for me as a VT, because it's all fun and games seeing this nice private dentistry, but as a DFT you're going to be doing NHS hardcore solid dependent dentistry, and that's what I wanted to see. So I did a day in a busy NHS practice, and I loved it. I still loved it. I loved the amalgams. I loved the, you know, the big crowns. I loved the metal crowns. I was like, this is crazy, but I love it. Very different, but it was nice to see, and a very good learning curve. And then I also, once that all finished, I did a week in Japan, which was amazing. My uni were very kind enough to have some contacts in Japan. So my perio professor had a link in a dental school in Yokohama. So again, I saved up a lot of money. I have a lot of clothes. So I buy a lot of clothes, and I buy a lot of vintage clothes, and I buy and resell them. So I bought a lot of vintage clothes. I sold them on eBay and Depop and all these apps, and I made an elective fund. So out of that elective fund, I was able to buy my tickets, and I funded my own trip to Japan. And that was crazy. They are miles ahead dentally from us, miles ahead.
In what way? Is it digitally that they use digital aspects of dentistry more than we do, or what was this?
So much. obviously like GC and stuff, like one of the major players in the game, dental materials wise, it's from Japan, right? So like their dental materials is insane. Like the line, we went to, part of our elective was also going to the GC factory headquarters. And like GC in Japan, for example, is like a lifestyle brand as well as a dental brand. It's crazy. So like they were really, you know, like, yeah, they're miles ahead with like, they do a lot of AI, a lot of CAD CAM, a lot of sort of assisted dentistry there. But also what I feel is their hospitality and their culture. They're so polite and so wanting to give, and like the dentist, like the respect that I saw, like a patient had her tooth taken out in the hospital. She was in so much pain. She literally left and was like, thank you so much respect. And it was so nice to see like that culturally was quite different, but also the way they work is amazing.
No, as we just bring this section on dental school to a close, I want you to talk about final year, and also for any King's students wanting to apply for prizes, you know, how to go about doing that.
Yeah, so final year was brilliant. A lot of people say they hated final year. I love final year. It was one of my favorite years. A lot of pressure, you know, like with DFT applications and exams and all these things going on, but I really enjoyed it. I think my advice would be to anyone like in fifth year, and I think I took my own advice when I did fifth year. Get involved. Just get involved on every clinic you can. Whether it be an extra clinic or whether it be a clinic that you're just not very confident with, just do it. And that's what I did. Like we had a few max fax clinics at at King's Hospital in Denmark Hill, and like that's like for medics, but medics and DCTs, but they let the final years go there. So I went there and I was able to take screws out of people's jaws, and I was able to like take out IMFs, and I forgot what IMF stands for, intramaxillary, something like little screws for people that aren't.
Fixatives of.
That's it.
Yeah.
There you go. So yeah, I was able to like take those out and put them in, and like with the assistance of max fax doctors, it was amazing. So
this was optional.
It was part of our curriculum, but a lot of people would go there and shy away from doing anything because it was quite, it felt a bit out of our depth. You know what I mean? You just feel a bit out, like once I had to assess a trauma patient who had trauma to the ear. But really, like if you think about it dentally, you learn everything about the ear. You learn the whole face. You learn the eye anatomy. Really, as a DCT, which is what I've got as my next step, it's part of the scope, you know? So it was challenging. And at times I felt a bit like, what am I doing on this clinic? But I learned so much from that. And then, you know, I also was able to like, from that, do a lot of complex endo in fifth year, a lot of complex crown preps, loads of complex extractions. And I think I was just getting involved, you know, just literally nagging the tutors and getting involved, because really that is your next stepping stone before foundation training when you're an independent practitioner. So yeah, that would be my advice for any fifth years. And that's what I did personally.
Fantastic. And in terms of, because you got the Portsmouth prize, how do those prizes get allocated?
So Portsmouth prize was really nice prize to win. In King's, in your fifth year, we have an outreach, and the outreach is in Portsmouth Uni, so the Portsmouth Dental Academy. There's also one in a place called West Norwood, which is like South London, West Norwood Dental Centre. But I wanted to go to Portsmouth and pick Portsmouth because you're able to go there, go for a week and stay in the halls. They pay for your travel. It's really nice. So it's like a break. And I wanted that break from London once a month, which is what Portsmouth let me have. Because, you know, being in London 5 days a week in your fifth year gets quite intense. So I wanted that break to go to the seaside, and it was nice. It was a group of us. It was very relaxed, very chilling, and the dentistry was different from London. Winning the prize was I didn't even know I was going to win. So the prize itself was like the person that added to the ethos of Portsmouth and treated all patients with respect, dignity, and incorporated teamwork into all of their treatment and whatnot. I did a lot of extracurricular at Portsmouth. I was quite involved in So when they were basically doing their sort of campaign to get the next lot of fifth years, I recorded a video, I edited it. It was like a big iMovie project, like a 20-minute video. Did a lot of help on there. They've got a thing called an initiative called Brush Up,
Okay.
which is where you go to like primary schools in the area and apply fluoride varnish and give OHI.
Okay.
So did a lot, helped with that a lot as well. And also I think I just really like got to know the tutors and the nurses, and I was always willing to help. Like that's the thing, like if you're free and you're sat around and your patient's gone, why wouldn't you want to help a colleague that needs help? Why can't you just go and pick up the suction or help them mix some alginate?
Yeah.
I just don't see why you can't do that. And I would get frustrated when I would be at uni and I needed help and there were people sitting having a chat. We're all guilty of it. I've done it. Like, let's be real here. We've all done that. But, you know, why not help if you can? So that is how I think from what I know, winning that prize was just down to how I was at Portsmouth, and then also like helping out extracurricular and making that video and helping and doing all of that and being I was also the Portsmouth rep. I should add that I was the rep for my group.
Yeah.
So same as the year rep but for my group. And then I also was quite vocal in promoting Portsmouth to the year below, because I was like, you guys should do it, it's a really fun year kind of thing. I think all of that kind of came together to let me win that prize. It was quite nice.
Fantastic. I think as we come to a close, it's interesting that there's this roller coaster of you deciding I really want to do dentistry.
Yeah.
And then in first year, I want to transfer to medicine.
I know.
And then coming back to the place where you're clearly passionate about dentistry, enjoying dentistry, you know, doing more than you need to, and networking and electives and IMFs. You know, it's quite a roller coaster, I'd call it. I mean, what would you say, just in summary, your experience of dental school has? What has it been?
Crazy. It was a crazy 5 years, but I loved it. Like, and I'm not glamorizing it in any way. Like, obviously, it's hard. You know, they're long nights, late nights, a lot of coffee, a lot of anxiety about exams. Like, I faced some anxiety in my fifth year, and I've never had anxiety or mental health, but I went through that. And I'm not saying that that's not a struggle, but what I would say is just roll with the punches. You know, you need to be flexible. You need to put in the effort, and just like, when you're in uni and you're a first year or a second year, don't aspire to be that Instagram dentist that does sexy dentistry 24/7, because it's not realistic. Like, dental foundation training is a shocker, number one, but for every Instagram dentist doing that sexy dentistry, as I like to call it, there are 100 doing everyday normal dentistry. And although it's a lovely part to get yourself involved in, there are other branches of dentistry like special care and sedation, like prosthodontics, like root canal, like endo, that we can also look to work towards. And I think that's what fifth year taught me, is it's just more than what we see online. So just roll with it and make the most of it and network. That's what I would say to anyone, you know, wanting to go through this journey and in fifth year. And don't get knocked down if someone tells you that your filling looks bad or your endo's short. It's fine. It's honestly fine. You're a fifth year. Don't worry. Yeah.
That's really good. I think that brings us to a nice close for this video. So guys, part 3, make sure to get onto that. We're going to be talking about dental foundation training and how you can get the best case presentation.
Yeah.
We'll catch you then.
Sure.